You start, Bhuvna.
Yeah, sir. Okay. Quote, which says that what you are is first originated inside you, and then that thought gets transferred to others. What we are and how we are going to take any situation positively and as an opportunity stays inside our mindset. So what we were in a lockdown all these days to protect ourselves and to prevent the spread of the disease. That is, to flatten the curve and to break the chain. But nobody can announce a lockdown for our positive thoughts and growth mindset. And by attending this session, we already started to focus on future adaptations and we broke the COVID chain mentally. How we are going to adapt? What are the guidelines and how will I resume everything? You might be having these many questions inside you. You also might have answers and ideas and ways and means to implement it. But if we are a leader, we will not only know the ideas and ways of implementation, but also share it with as many as we can. Here we have one such leader who is a package of knowledge, inspiration, optimism, and energy. The founder of SANS Foundation, and for the past 2 decades, he had worked with corporate sectors like Max, Fortis Hospitals. Presently, he is with the National Heart Institute and has also written many books, and especially Clinics in Chest Medicine, a manual which explains the disease of respiratory system in a very elegant and understandable way. And the speaker of the session, I welcome you, sir, Dr. P.P. Bose, on board. Next, I would like to extend my warm welcome to Dr. Siddhant Datta, who under the guidance of Dr. P.P. Bose have been immensely working to take CICM, the Clinics in Chest Medicine, to next level. We welcome you also, sir. Fourth, the pharmaceutical industry, we as an organization has taken privilege in being the knowledge partner, and the SANS and FORGE together as an initiative, CICM community emerged, which is conceptualized as a communication portal to reach people with education modules, online trainings with certificate in courses, etc. I would like to request all of you to kindly visit cicmindia.com, an exclusive website for clinics in chest medicine. I repeat, cicmindia.com. So without any further delay, let's get inundated with the information from an inspirational leader, Dr. P.P. Bose. Before that, I would request all of you to stay muted. If you have any queries, please convey it in the chat box. We'll be happy to answer. The virtual podium is on to you, sir. Hello?
Hello. Can you hear me all?
Yeah, sir, yeah.
I could see Divya. There's so many my students and senior professionals around. And my heartfelt regards to everybody. Each and everybody is a true soldier in true sense, and my salute to everybody. You people have the tenacity to fight this invisible enemy, and my best wishes to all of you. Now a time has come, dear friend. We have to learn to live with this virus. We have to learn to live with this invisible enemy, and how we can cope up with this. I like to share my food for thought, and this is what we are going to take our third level of CICM series after having successfully done 2 shows. And if you could remember the last show which we did at National Heart Institute, I could see a lot of people appreciated that initiative. This is in continuation to our CICM series. Today, my dear friends, will talk about not about COVID. We will talk about the post-COVID adaptations. I call post-COVID is a new renaissance, is a new living, is a new awakening. Everybody has to change their mindset. Everybody has to redefine himself. Everybody has to introspect, has to raise his own level to take that kind of challenges. My dear friends, you cannot avoid COVID and endemic, but only thing, like a good soldier, you have to enhance your immune system, you have to enhance your mindset to take care of your dear ones, the patient. That is the only way our healthcare providers can take an advantage. Dear friends, I will be quickly going through certain facts, then we will have a interactive sessions, and I will request my dear student and a senior professional, Dr. Divya, also to be one of the panelists. Then if Dr. Richa is there. She can also join us because these are all very senior professionals. They have contributed significantly in the field of specialty, which we are going to talk about. The most important specialty, the respiratory care provider in a difficult situation, the therapist, the master physiotherapist, the respiratory therapist, they are going to play a pivotal role. Already they have played a very important role because the society will find a lot of change in the healthcare delivery system. We have to move from clinic to the hospital to the home care level. So dear friends, I'll quickly share those few slides before we go into interactive session. My associate, Dr. Siddhant, is here, and he has significantly contributed in making those certain, the thought process which we are going to share. So before we get into those slide screen and all those things, I'll continue. So what I'm trying to say is that, dear friends, if you want to do well in your this post-COVID scenario, the first and foremost things you have to enhance your mind, your most important immune system. You have to come with a lot of positive mind, and that is the only way you can fight this devil. If you could read the newspaper, every day we are getting a rising corona. But still, if you find, fortunately, in this part of the world, we don't have much of mortality so far. But if we follow a good rule, I'm sure you can do better in your clinical practice. Welcome to our series of clinics in chest medicine. How it all started, dear friends, if you recall, if you see our social sites, we thought when we heard of corona, and since our country is used to flu epidemics, we didn't take it much of seriously. When we heard the things are spreading, as a respiratory care practitioner, we thought it's our moral responsibility to create a formidable team to reach out to the people and help all those who are not that fortunate. We reached out to the community, create a character called Fight Corona. If you could see this character, Fight Corona, this is a character we created, and this character is in our mind. This is character each and every component of CICM team, from Bhuvna to Sandeep to everybody who is there with us, who is a Fight Corona character in the mind. So dear friends, what is this Fight Corona character? Let me explain you what we have done. Now, what is this? What is this Fight Corona? Fight stands for our definition. If you really want to be a good fighter, the first and foremost thing, if you have chosen this profession as a healthcare professional, you have to feel good about it. You have to be positive. You have to develop that type of mindset, because what I always say, if you have the aptitude and attitude, that decides your altitude. The right attitude is the most important. You have to feel good. You should not develop an hatred, because you have to learn to live with this devil. So F stands for feel good, and you can only feel good if you learn to improve your immune system. If you don't care of your immune system, so then you will not be a good fighter. So that's why we'll talk about the self-preservation is the first law of nature. That is the first thing in post-COVID scenario, we have to take care of ourselves. Then, as you know, COVID is a respiratory care virus. It gets into your upper respiratory first. So you have to take care of your upper respiratory, and the best way to take care of the upper respiratory is a lot of nasal cleansing and gargle with iodine. As you know, iodine is in germicidal. It has no resistance. The moment it comes in contact with the surface, it kills all the viruses and bacteria. So good iodine gargle can take care of your upper respiratory. Then of course, the fomites, the hand wash, the hand wash, the hand wash. The most important thing to prevent COVID is to take care of your hands, because that is a thing which can spread infection to your eyes, ears, and everywhere. So hand washing is the most important part of prevention. And of course, our tips, which we are going to talk about it. This is our fight corona character. And if you find this character should be, each and everybody should be this fight corona character, because we have to fight it out. We have to live with this virus. We have to raise ourselves. And that is the only way we can adapt to the new scenario, what we call new renaissance. Dear friends, the few things you must know. What exactly is this COVID-19? Though you must be reading a lot of things about it, but let me tell you, if you see this virus, this is a little spiky, that's why it's called the corona. But if you see what we are trying to show here, this is the most important thing is the spiky, which is critical for host, critical for binding of host cell receptors to facilitate entry of the host cell. So you see, dear friends, this is the most important thing, because as you know by definition, virus is an incomplete host. Each needs a complete host for survival. This is called spike protein S. Then of course you have another protein called nucleocapsid protein, which bounds to RNA genome to make up nucleocapsid. So that means this nucleocapsid protein makes the virus, ultimately it takes the it makes a complete virus. Then you have this envelope protein E. If you see this interacts with M to form the viral envelope. Many times what happens, because of the rapid mutation, many of the viruses may not having the envelope, but this E is a very important part which combines with membrane protein. Membrane protein, if you see here what we are showing, this is the membrane protein, which is the central organizing of COVID assembly and determine the shape of viral envelope. So dear friends, you have to understand this virus, that if you really, this is the spike, and if you really want to understand the virus, this is the way to understand. And if you can somehow can kill this virus at the point of entry, and that is how the hand washing plays a role through soap water. We'll talk about it. So now let's talk about what are the symptoms of COVID. Let me tell you, dear friends, anybody who is having fever in this time should always keep a possibility of COVID, because it is rampant, it is pleomorphic, it works in the principle of 2 to the power n, it has spread like a forest fire. So when you have anybody unusual with high risk of people talking about weakness, fever is a very important component, because it's an infection. If you have fever with all the symptoms can range from weakness, dry cough, sore throat, shortness of breath, respiratory, nasal congestion, body ache. Even recently, I have come across a patient with gastric symptoms, but the fever is a very important component. Whosoever comes with fever, don't neglect it. Isolate them, get a COVID test done and confirm it. Dear friends, the most important thing is a little repetition. Most of you know, the virus that COVID-19 is thought to spread mainly from person to person through respiratory droplets when an infected person coughs or sneezes. And this is what we are trying to show. These droplets can land in the mouth or noses of people who are nearby or possibly inhale into the lungs. And spread is more likely when people are in close contact with one another. That means if you can roughly make a distance or social distancing about 6 feet, you're protected, because by the time the infection droplets are not in a position to reach your respiratory system. And that's why I will request all these healthcare professionals to go to this plague epidemic. What they used to do in plague epidemic in 18th century, people used to carry a stick in hand just to show that you stay away, don't come. And with a lot of masking and stuffing, this was the protocol. If you see a lot of elderly people who carry the stick, you must have seen your parents carrying it, just to say, to develop a culture that stick tells you, you stay away. The social distancing, my dear friends, the social distancing should be the new norm in COVID renaissance. Always maintain a social distance and always take a stick and see. That is a distance of a 6 feet. So maintain that 6 feet social distance, which wherever you are, whatever you are doing, try to see to it that social distancing is the only way you can spread the droplet infection. When do you suspect? All symptomatic individuals who have undertaken international travel in the last 14 days. You always remember, and I'm not talking about what has happened in future also. If you find the symptoms which I mentioned, next couple of weeks or days, the airlines also will start opening up. But anything linked to international travel, think of COVID in the next couple of years. All symptomatic contacts of laboratory confirmed cases, or all symptomatic healthcare professionals, or all hospitalized patients with severe acute respiratory illness, fever and cough or shortness of breath. Remember, whosoever comes in contact with symptomatic patients, all symptomatic healthcare professionals, patients, all hospitalized patients with severe respiratory, you consider them as COVID unless and until proved otherwise. Asymptomatic direct and high-risk contacts of a confirmed case should be tested between 5 and 14 days. Many times what happens, you try to do the testing on the first 5 days, it may not turn out to be negative. But usually the incubation period of COVID is around up to 14 days. So 5 and 14 days, many of these high-risk contacts may be positive. And if you have symptoms, refer to cough, shortness of breath, refer them to a place where this care can be taken. Direct and high-risk contacts include those who live in the same household with a confirmed case and a healthcare professional who examined a confirmed case. Remember, I repeat, direct and high-risk contacts include all those who live in the same household with a confirmed case and the healthcare who examined. That means you people, if you have gone to examine the patient, and all those households who are staying, they are all high-risk contacts. So you have to keep this. This is a CDC guidelines. You have to follow this protocol. Now, let me tell you, dear friends, there are two very interesting things. Ever since the society has started mingling, you have seen the lockdown has partly been opened up. You will find there is a tremendous amount of conglomeration of asymptomatic cases and symptoms in the society, because we belong to a low density population. The people are coming from a high density population, our daily wages and all, they may be an asymptomatic carrier. They may be relatively young. So they may not have symptoms. But the biggest challenge of the COVID in the post-COVID time is this: how to take care from this asymptomatic carrier. They may not have symptoms, but they can give you those infections, and especially the people who are elderly, who have comorbidity, they can pick up this. So it's very important to understand there is a significant population, maybe asymptomatic carrier, and they may be the carrier of infection to the high-risk people, or the people, or maybe the healthcare professional, because they are at a high risk always. Now, this is very, very important thing before I talk about the changes which you should have in COVID and soap water. Now, dear friends, if you see why this soap water plays a miracle for this kind of virus, because what happens if you see, as I told you, the virus which I explained you, that the soap molecule, when this virus comes in contact with the soap and water, the surface of the water, which is water loving or hydrophobic, and the tail of the virus, what you call, is hydrophilic. So what happens? It creates a shearing stress when you talk of soap and water. So what happens? It is something like the peeling of an orange. So you peel the orange out, you don't allow the virus to settle in your system. So soap and water acts as a suction on the surface of the virus. The water and the soap takes the toxic part of the virus away from the shell, and this is the magical part of the soap or water. So my dear friends, we are all healthcare professionals. As much as you can, if you do wash your hands, better you are. I recommend people to go at least 10 to 12 times of hand washing with soap water. This is the only way you can learn to. So these are the challenges you have to understand. And since we have got this soap water with us, this can really help us. Now, this is the triage of patient with suspected COVID-19. So as I told you, this algorithm, my dear friends, all these slides will be in our websites. You can always refer to it. You can always discuss, send me and text me. I can reply you. But in nutshell, if your fever more than 38 degrees and at least one sign or symptom of respiratory distress like cough or shortness of breath, place medical mask on patient. This is the first guideline. Don't allow the virus to spread you. Identify travel and direct exposure history. Has the patient traveled or resided in another country where COVID is spreading during the 14 days prior to symptom onset? Or has the patient had contact with an individual with suspected or confirmed COVID-19 during the 14 days prior to symptom onset? And as I told you, why 14 days? The incubation goes up to 14 days. So anybody who has troubled and has the symptoms, especially because what I'm saying, you have to be very careful about the international patients. Because I keep telling, since it is an RNA viruses are susceptible to genetic variations. The study says there are 200 different varieties of mutant viruses are moving around. These international viruses, which has hit the Western world, they were relatively elderly people. They were not that immune competent. So when these immune compromised people are hit by a RNA virus, you never know. These viruses are entirely different what the viruses we are having presently, what you call the domestic virus. So there are different varieties of viruses which is moving around the globe. But since the Western world, the most populous countries who have been saved, but if you see the statistics, the 10 populous countries in the world comprises 60% of the world population. And out of these three countries, Brazil, Russia, and America, also part of the populous countries, they have been the victim. So you have to see to it, all these countries where the corona rates are very high, if there is a travel history or anybody who is traveling, keep in mind there may be those mutant varieties unless proved the right ways. So anybody with a travel history, you have to be extra cautious. This is the new adaptation, you have to talk about it. Not only what has happened, in future also, maybe next so many years, maybe at least 3-4 years, till we are very satisfied with the vaccination and we are sure that we are able to take care of the evil. You have to see to it that anybody who has troubled and developed symptoms, you consider it's a difficult COVID and probably have to take care of it. Then, yes, separate from the rest of the patient, place the patient in a single person room with door closed or in other designated area. Ensure healthcare professionals caring for the patient adhere to standard contact and droplet precautions. We'll be talking about it. Only essential healthcare practitioners with designated role should enter the room and wear appropriate. Remember, I'm telling you, dear healthcare professionals, you may be playing different role. You may be playing as an adjuvant, as a support, as a main person, whichever the role you're playing, whether you're working in HDU or ICU or home care level or at clinics or maybe a different institution level. You should know your responsibilities. You should not be taking unnecessarily a leadership role. You should be trained enough and you should know your limitations, keeping your limitation in your mind, take the leadership role and take the responsibilities. Inform, notify the hospital infection control program and others. So remember, whenever you have this situation, you make a team. It is a notifiable disease. You have to develop a infection control program. And I think every hospital has developed it, what you call critical care delivery group. So we have to inform the professional involved and everybody has to be taken in the loop. And of course, if you don't have all those symptoms, continue with usual triage and assessment and care. And if you don't have those travel history, continue with the usual. These are the very important things, the algorithms which you should keep in mind. And elderly people may not develop fever, but new onset of cough or worsening respiratory symptoms, you take it very seriously. I again tell you, anybody who is especially in India above 65, elderly people with new onset of cough, you should be careful. Dear friends, this is another algorithm we have put in the, we'll be putting in the site. Chill, sore throat, dyspnea. What is the protocol you have to follow? Get a complete. If there is a dyspnea, straightway take the measure 4. We have classified into measure 1, measure 2, measure 3, measure 4. So anybody with the chill, sore throat and cough and dyspnea or hypoxia, remember, everybody should carry a pulse oximeter with you. I'm sure you carry it. Anybody who is hypoxic with a chill and sore throat, go to the measure 4, supplemental oxygen, admission to an isolation ward. Arbidol is a new antiviral, we talk about it. Or some people are talking about linezolid in India, chloroquine, whatever, but you have to think at a measure 4 level. If the dyspnea, no hypoxia, complete blood count, get the fever. If there is no fever, get these protocols done, absolute eosinophil count, which all those things, and go to the measure 1, where you need a home care and oral azithromycin or amoxicillin. If you have fever, then get a CT scan. You can look for the detection of virus. You have to look for, this could be a viral pneumonia, again isolation, get it COVID test done, start quinolones, and follow those. If it's positive COVID, transfer to a designated hospital. If you have no viral pneumonia, other cause of community acquired pneumonia, follow the similarly community acquired guidelines, transfer to an undesignated hospital or discharge room. All those things you will put in your website. You can go through this flow chart, and if you have any query, we can discuss about it. In this APTA guidelines, which is a CDC guideline, they say the facility should consider organizing separate teams to manage. There has to be classified people. Everybody should not get into this area. There should be separate people for HDU, separate people for ICU, separate people for OT, separate people for physical therapy, separate people for home care. All the guidelines are different because probably the level of care must be. You have to develop in your mind a level care, whether you want level 1, level 2, level 3, level 4. So you have to understand, if you're working at all the different levels, keep the mindset of a level 4 then. If you're working at the level 1, then keep the mindset of level 1. So you have to understand where exactly, because what I understand, you may be working at a different level. You may be the true support of the hospital or the healthcare system. Physical therapists who are practicing with ICU should have specialized knowledge of working in that setting. I repeat again, you should know what is ventilator, what is running, what are the gadgets being used, how frequently there is disinfected, the protocols, everything you should be knowing it. While other therapists in the facility who have ICU experience but are not currently as well as physical without recent cardiovascular experience should be facilitating rehabilitation and discharge planning. That means you take your role, what kind of role you want to play, whether you want to get into an active role in ICU, then you should be very well versed like an intensivist, and you should take care of yourself because you're going to spend more time. Accordingly, you have to groom yourself. Physical therapists with advanced ICU skills should be supported to screen patients with COVID-19, with some being called as clinical leaders. That's why I'm saying in post-renaissance in COVID, you can be a clinical leader. So you have to educate yourself. You have to raise your bar. You have to follow those protocols to really handle and screen, because you will be the frontline soldiers. So if you are an advanced ICU skill, it will always enhance you. Staff who are pregnant should avoid exposures. Remember, see to it that people they should avoid. Physical therapist examination and intervention should be provided only when there are clinical indication for needs such as mobilization, exercise, rehabilitation, etc. in patients with comorbidities, creating significant functional decline and or at risk for ICU acquired weakness, with guideline authors writing that unnecessary review of patient with COVID-19 within their isolation room or areas will have a negative impact on PPE supplies. So what I'm trying to say, that if the therapist unnecessarily should not take into regular mobilization and activities, you should know your role. People with comorbidities, you have to follow certain non-touch techniques. You have to give therapy. At the same time, you have to evolve yourself in such a way that you avoid certain contact with the patient. The contactless contact is a new mantra in the post-COVID guidelines scenario adaptation, which you have to follow. If aerosol generating procedures are required, they should be conducted in a negative pressure room, or at least in a single room with the door closed, with a minimum number of staff, all wearing personal protection equipment. Coming and going should be minimized during aerosol generating procedures. Let me tell you, aerosol is the biggest cause of COVID spreading in the hospital sectors. Physical therapists should not implement aerosol generating procedures, including humidification or non-invasive ventilation, without first obtaining agreement with a senior doctor. I think not only you have to learn yourself, not only you have to skill yourself, you also should follow certain written protocols. Don't go by verbal orders. He said, you give me in writing. This is a very important thing, dear friends, you have to follow. Physical therapy should take droplet and earbud precautions, including use of high filtration mask when providing mobilization exercise. And there is a risk of patient coughing or expectorating mucus. You have to unnecessarily, when you do a chest physiotherapy, other techniques, you have to really take care of the droplet and airborne precautions. And direct physical therapist intervention should be considered only when a significant functional limitations. Remember, you have to classify the disability. If there is a significant functional limitation, example, risk for ICU acquired weakness, frailty, multiple core, then you take that risk and take. Unless and until, don't jump into all the patient and do the needful. Staff should be trained in donning and doffing. I told you, donning and doffing of personnel, including N95 fit checking, is very important. We are going to show the slides what is donning and doffing. For COVID-19 infected patients who may require aerosol generating procedures, airborne precautions should be followed that include N95, P2 mask, fluid resisting long sleeve gown, goggles, face shield, gloves, and guidelines also recommend hair cover and shoes that are impermeable to liquids. So dear friends, these are the guidelines. No, these are the few simple tips which I'll talk about it. Don't get panicky. You have to learn to live with the we are every day we are seeing ICU patients, clinical patients. We are visiting people at the home level. We are taking care of ourselves. It is possible. Only thing you have to develop a system in your mind. You have to follow certain protocols is possible. My dear friends, three things you should remember. IEC. This is a decade of IEC: information, education, and communication. This is applicable to patients. It is applicable to doctors. It is applicable to you. And patient service delivery works on these three principles. Inform, evidence-based care of patient with COVID. Inform everything to the patient. Information. You should be rightly informed. At the same time, the patient should be rightly informed. Both way information is very important. Don't go by the loose information. He said like that. Go to the scholarly article. Read important new articles. Go to the right guidelines. Get yourself rightly informed. And our CICM platform can help you out. Education. Guidance for discharging a patient with suspected or confirmed COVID from hospital to home or a long-term facility. You have to educate yourself. You have to write down those protocols, what the patient is going to do. There you have to need to get educated. We will have different forums to talk about these discharge protocols and rehab protocols which we have developed. We can share with you. And of course, communication, communication, and communication. Look, in the post-COVID scenario, the physical contact may be less, but you know the most important thing of a healthcare practitioner is a physical touch, and that is only possible if you're a good communicator. So you have to communicate through non-touch technique. So how can you do it? So this probably needs the use of telehealth strategies and what we call the telemedicine or tele-ICU, the new technology which is coming. And I'll show you what we are doing in SANS and how we are educating people. Probably you can also adopt the similar things. Dear friends, first and foremost thing, self-preservation is a first law of nature. I told you, use different trackers to see the data stream for situation awareness. We have Arogya Setu, you have MHFD, you have WHO, CDC. Trackers can sometimes help you where you are going, whether you are in hot center, whether you're in cold centers. Because what I understand the scenario as a doctor, because I see you as if I am working in your shoes, because we have to do as a doctor in India, as a healthcare professional in India, we are multitasking. We are seeing patients in clinic, we are seeing patients in ICU, we are seeing patients in rooms, we are seeing patients in HDUs, we are seeing patients in rehab. At times you have to visit the home, and probably you people are visiting more at the home care level. So you have to follow these trackers. Download the trackers, but at the same time, little careful. Don't give all your information, but use tracker which suits you the best. It's something like Google mapping. It's a Google map which helps you to track it. So I think this is a one thing which all of you should adopt it. And the most important thing, prepare your clinic, your office, your working place, where people come to you, where people have the confidence, the faith. So these are the certain things which we'll be uploading before patient arrive. This is what we're trying to show. Prepare the clinic, communication, all those things, because we have a limited time. You can always go through slides. You can go, you have to prepare the clinic, you have to communicate with patients, you have to prepare the waiting area, you have to prepare when the patients arrive, after the patients are assessed, train and prepare your staff, all those things. The skilling is very important. At different level, you have to skill them. At different level, you have to communicate to them. Everything, the environment, the ecosystems, you have to see to it. There is a minimum viral load in the system, minimum transmission of infection in the system. Now, few tips, dear friends, I want to share with you. Now, what is the elements of standard precaution? Hand hygiene. In personal protection comes hand hygiene, respiratory hygiene, person protection according to the risk, safe ingestion practices, sharp management, and injury prevention. I think all of you should agree with, follow the good segregation of waste, take care of yourself. Then when it comes to institutional practices, regular hospital disinfection, all surfaces, walls, touch points, safe handling, cleaning of patient equipment, safe handling and cleaning of soil island, waste management, and environmental cleaning. These slides should get into your mind wherever you're working. Personal protection and institution guidelines. Now, dear friends, if I can speak to 100 people right now, thanks to this digital world. So we must utilize the digital world the best of our ability. If all of you could listen, it's thanks to our technology. Use the technology in his own innovative way. You can use YouTube, you can use WhatsApp, you can use any possible things. You can use simple audio, but go digital, be innovative. And normally I can say, what we are doing at SANS, what we do for every diseases, we have created images. This is in our desktop. Whether you talk of rehabilitation, whether you talk of COPD, whether you talk of an asthma, pneumonia, we have made very patient-centric images, based innovative images, and that is our desktop. But what happens, whenever the patient comes, we note down their number, develop a WhatsApp communication. In the WhatsApp, we send that image and send an audio accordingly, and patient feels good. And we tell them, just follow the audio which I've told you, go through this image. If you have any problem, send an audio. Audio to audio is a very simple way of communicating. I do so many virtual consultation a day. My technique is audio. I don't write audio and image. In the book also, which I've written, many of you must have seen, I made it very simple. The book I've used based on images, algorithm, and key points. Make it simple as possible. Digital can make your word simple. Use the digital technology. A lot of new technology is coming. We are not of, even in CICM, we are going to create a virtual hospital, which you will come to know shortly. We are going to make an app. We will get all the facility to reach out people. Then, of course, dear friends, everybody should have this thing, something like this. This is a tab. It's not very expensive. Use tabs for education. Don't come very close to the patient. You can demonstrate whatever you want to show, whether you talk of rehabilitation, exercises, back care, or any kind of mobility exercises. Tab is very useful, very affordable, and you can do wonders with this tab. Our each and every corner has tab. Our staff is using, our doctors are using, our healthcare professionals are using, and we have made contactless with using tab. So tab is a new change which you can bring. Then, of course, carry a small smart bag. When I go for my morning workout, there's a smart bag, and your bag should be such a smart so that you should be able to carry gloves, enough of mask, pen, and other tissues, and maybe hand sanitizer. So carry a smart bag. Maybe whatever the tools you're carrying it. Don't make it a clutter. Don't carry always a briefcase or a big bag. Now is an era of small and simple. So carry a simple bag, make it useful, and carry some pen drive and a tab. Carry a smart bag. Then, of course, your hand is a worst enemy. So take care of hand. So because hand comes in contact with your stethoscope, the scissors, the door handles, the medication, the telephones, your therapies, then your talk when you're visiting patients. So hand, and all the things of the hand you have to follow. And dear friends, remember, it's the 5 fingers, all the 5 steps, and the last, the wrist, is the most important. I'll repeat: the bubbly stage, in between the fingers, the back of the fingers, thumbs, back of the hand, every corner, and finally the wrist. Don't wear, when you're doing a therapy, sit with that it is hanging on your belt. Don't wear rings. Make it as free as possible. And I recommend that develop a habit of wearing a gloves, and you can do a hand washing with soap water or sanitizer while wearing gloves. But hand is the most important thing which you have to take care. And unnecessarily don't put your finger or put your hand on your face, because that is how the virus spreads. Then you see this hand washing protocol in ICU. This is a very important slide. Suppose you have visited a patient. Before touching a patient, then before cleaning an aseptic procedure, then after body fluid and exposure risk, then after touching the patient, and after touching the patient surroundings. So 5 steps of hand washing you have to follow. You must remember this slide. Before touching, before cleaning an aseptic procedure, after body fluid and exposure risk, after touching the patient, after touching the patient surroundings. The 5 level of hand washing protocols you have to follow. Then of course, this is the new jacket, the new, the suit which we have to get used to. The preferred PPE, use N95 high respirator for when you're handling, very probably you have to N95, otherwise a simple face mask can do the job. When you're handling COVID positive patients, probably you have to do N95, face and goggles, 1 pair of clean non-sterile gloves, N95 or higher respirator. When respirators are not available, use the best available alternate like a face mask, which we are showing it. Now what we are showing, principle of using personal protection. This is very, always clean your hands before and after wearing it. It should be available where and when it is it should be available where and when it is indicated in the correct size. Select according to risk or pre-transmission base. Size and risk. These are the things you should be very careful about. We can show for your clinic, you can wear we have designed a personal protection equipment which we can show all the strengths. This is a very simple raincoat material, very thin. We have designed it with a hood, and whenever we high load patients, we wear it, and this is really helping us. And when we leave the clinic, we put in soap water, so the soap water kills the extra viruses which has. And in the morning when we come, we leave it for 15-20 minutes, because sun is a virus idol. Everybody, if you want, all of you, this PP kit, I can in bulk get you a very affordable rate. We can help you because we know the tailor who is making. Dr. Siddhant will help you all. Always put on it before the patient, always remove immediately. And I'm telling you, this smart jacket, even if you're visiting, you should wear when you're visiting, you're doing home care, you're sitting in your clinic, you see Siddhant come here, he's fully equipped, and you see, even this is how each and every staff is equipped in our center, and this should be the month. Always remove immediately after completing the task and leaving the patient care area. Donning and doffing to be done. I tell you, donning and doffing. This slide is very relevant for all of you in the post-COVID adaptation, and it should not be adjusted or touched during patient care especially. This you should go through our websites. What is the donning? How gown should be? It should be properly fixed. Even the mask should not hang. There should be clip at the level of nose. It should not be goggles and face shield, gloves, how to wear it. Everything we are given. You can visit our website and learn more about it. So donning and doffing of personal protection kit is very important, because you have to take care of yourself. Self-preservation is a first law of nature, not only for you, your loved ones and your patient also. Now you see, this is what we are showing. Use protective face gears while chest therapy or suctioning. Now what we have designed, even if you visit ICUs, if you don't, carry a simple protective face gears. If you don't have a face gear in your bag, you can take a small synthetic bag which can be inflatable. We are using it. So whenever you go to the ICU, you can use this protective face gears while chest therapy and suctioning. We are using it. It's very effective. If you want, we can design few for you, but you should be careful. Now there we have seen the guidelines or rationales of personal protective aid. This is a chart. Everybody should be referring it. What you should be, when you should follow the triple layer mask, when N95, what are the gloves. These are the guidelines based on CDC. We have told for the visitors, for the patient, for the therapist, for the dead body, for the ICU, for HR, for high density, for the clinic, for help desk. This slide you should pin up in your clinic and should follow it very regularly. Now the question of disinfectants. Bleach. 1% sodium hydrochloride for disinfection of material contaminated body fluids. All of you should have 1% hydrochloride. This is a very good thing. You can clean most of the things, including your daily phones and everything, and pen and stethoscope. Several concentration may be marketed as 2.5 and 5%. If 5% solution available, mix with 5% with 4% of clean water. If 2.5% is available, mix 2 parts, 2.5%, 4%. This is also very useful information. Try to procure sodium hypochlorite. If you don't have, we can provide you. Clean and disinfect patients' areas daily with particular attention to frequently touched surface, countertops, door handles, and medical. Remember, your door handles are very important because that is the area where patients are touching. Use 1% bleaching powder for disinfection of toilets and bathroom. Remember, 1% bleaching powder means 33 grams in 1 liter of water bleaching solution, which is 30%. So 2 things I've told you, dear friends. Sodium hypochlorite 1% and 1% bleaching solution you should be keeping in your clinic for your personal use. Then this is called triple bucket system for cleaning. Procedure for washing, rinsing, and sanitizing, where a different bucket and sponge or mop is used. This is called triple how you. This is how you clean it. The whole concept of triple bucket system is that the germ should not come back to the same place. You have to keep on cleaning them, take it out. That is, instead of centripetally, you have to go centrifugally. That means you have to go from center to the periphery. First bucket with water and detergent used only for the purpose for washing, then rinsing, then third bucket contain water and solution shall be used for disinfection. This triple bucket system and this method of 8 should be followed in cleansing the system. Then few do's and don'ts, which I told you, you can refer to it. Maintenance, hold, all those things discuss about it. Disinfection, take care, social distancing, personal protection, very important. But the most important thing, you have to enhance your immune system. The few things I want to tell you here, which is very relevant. Now, what is immune system? Our immune system has got 2 components. One is mind, that is the most important immune system. Your hippocampus, your positivity, that you have to be always positive. A negative mind always catches COVID because the virus also always attacks a depressed and deprived persons. You have to be mentally very alert and positive. The second is your physical system. The physical immunity comes as a function of your exercise, the daily stretches, the regular treadmill which you do if you don't have an access. Is very important, is a virus saddle. Do all those stretches. And the most important, your diet should have very rich in antioxidants. And one of the technique which we tell people is that in the morning, if you have a glass of smoothie, which comprises a lot of fresh fruits and vegetables, don't add water. Like for example, normally what we take, the tomato, which is rich in lycopene, carrot, which is rich in beta carotene, then the citrus foods, which are rich in vitamin C, lemon, which is rich in vitamin C. Then you can add and whichever the vegetables, even the ginger, which looks like a stomach, which is an anti, which takes care of the stomach. So put ginger, put carrot, put tomatoes, put bitter gourd, which is an antioxidant. Then all the citrus fruits. Club them together, don't add water, run it, it's a smoothie, add a little rock salt and some mint leaves, it's amazing. Start your day with a detox, it enhances. Remember, the first half of the body is the elimination system because you're taking bath, you're going, you're driving, you're reaching, you're in a rush. That is the time you have to feed your system with a lot of nutrition. So that is very important. Your first half of the body should have a good detox. Then, of course, we have told you when the patient suspected and go on. So all those protocols we have already discussed. And what we are doing in SANS rehabilitation program, use personalized tools. I think resisted bands you should be using more frequently in your clinical practice. Tailor-made resistive bands are different color codes are available. our all rehabilitation are done with resistive bands. This is a new adaptation, you should be following it. Then of course, this is very important. Whenever you go for a therapy, see to it you start with a cognitive behavioral therapy, because here the patients are disturbed, you are disturbed, the environment is disturbed. Cognitive behavioral, every healthcare professional should be good communicator to understand what is CBT. Every day you should be doing CBT for yourself, for the patient, for your life bonds, because ultimately it is a thought, behavior, and emotion will decide your future. So cognitive behavioral therapy and what we call the journey from illness to wellness. We are all ill. We know we are disturbed. We are talking big things, but we are all disturbed. But only thing, by we, from I to we, that means from illness to wellness, this is a protocol we follow in SaaS. We talk about nutrition, it's a new pyramid. We talk about breathing techniques. Our breathing techniques are followed globally. Someday we'll talk about the breathing techniques, the exercising protocols, and we believe a philosophy that self is not only physical health, it is a journey from physical wellness, mental wellness, emotional, social, environmental, spiritual. So you have to give 360 to people. You have to talk about spirituality. You have to talk about physicality. You have to talk about the mental health. You have to talk about the emotional health. You have to talk about the social health. You have to talk about the environmental. Then all you are a complete healthcare professional. We have designed protocols for it. We can discuss more about it. So my dear friends, if you are attending COVID patients or comorbidity patients or suspected, see to it that you make a protocol. And if you are visiting this patient or they're coming to, make it 2 to 3 times a week, which we are following it, and always see to it, whenever the patient comes to you, this is always assess their nutrition and respiratory assessment. And nutrition assessment by simple anthropometric measurement, respiratory by simple peak flow and oximetry, and the breathe hold techniques you can do it. Do motivation, do breathing exercise. You should have spirometry. You should have a PEEP valve. PEEP valve is must, because PEEP is a very important thing, because breathing exercises, expiratory is very important, inspiratory muscle techniques, mucus clearance, aerobic exercises, and education. This follow these rules, and I'm sure if you give in written, follow a contactless program, you will be benefited. Thank you, dear friends. Don't get panicky. Don't press a peer button. Follow these basic rules, and I'm sure you will do wonders in your post-COVID time. Stay blessed, take care, and have a wonderful year ahead. Any questions you can discuss now? We are open to. I can ask. We have Sandeep, we have Bhuvna, we have Siddhant here, we have Dr. Divya also here, and I don't know who are the senior people here. They can ask me questions. They can coordinate with others. And we have Ruchika also from AIMS. She's there. And if you have any questions, I don't know, because this is a limited time, a lot of things one can discuss, because the adaptation is a continuous process. You have to keep changing yourself. So if you have any questions, ask me.
Sir, as such, no questions. Am I audible?
Yes, Ruchika. You're from AIMS?
Yes, sir.
Yeah.
Yes, sir. I'm a physiotherapist at CTVS AIMS.
Yes, Ruchika.
It's been 15 years now. And I just missed your introduction. You are a chest medicine specialist, right?
Yeah. I'm a pulmonologist. And
what I am thoroughly enjoying is the fact that you completed A to Z of even physiotherapy. I mean, you did not even miss the inspiratory muscle trainer. I was wondering you will or you will not. I really don't know my physiotherapist colleagues at trauma who are actually seeing the corona patients. We are only seeing
Ruchika, let me tell you,
yes,
if a good doctor is not who talks about speciality. Good doctor is the one who is a 360 degree as a person. So
true,
you have to
very
be a
true.
healthcare. I think the better world for a doctor should be a healthcare professional. So you
True,
have
sir,
to
true.
be everything. Then only a good super specialist is a person who is a good physician. And thanks God,
Right.
I started my career as an MD in internal medicine, so that's probably helped me. So it is not the hole in the patient; it is a hole in the patient. WHOLE, not HOLE.
Got
So you
it,
have
sir.
to be very
Got it. It's
holistic about the
holistic.
patient,
It's
not about the
complete.
simple hole in the patient.
So all I wish to know is that practically coming down to the ground when it comes to practice over my last 15 years, we also took time getting inspiratory muscle trainer or an a cappella or a pep device to the patients. Foremost thing is our clientele, our patients are really poor. And I wish to really know, I am really wondering if corona patients are really getting it, because you have been telling about all the don'ts of physiotherapy. No, I mean, the physiotherapist has to keep away, and spirometry is okay. What about the IMT and acapella? Are they really reaching the patients? One. Two, as a physiotherapist and as a doctor, sir, since we are also willing to heal the healers, I mean, we are more susceptible. I really don't know if all the doctors also know that the inspiratory muscle trainer is going to help us all as well. I mean,
Look, this is this.
so because we have to have something preventive as guideline, because we don't have ventilators as much as they are needed. We all
Look,
know
you have
that.
to, I heard you, Ruchika. The few things I'll tell you, which is a very important pointer. If you remember one thing, when we talk of any virus, especially when we talk of RNA virus, you have to understand two things. There are
No,
two
no,
aspects of any virus. One is an infection and is an inflammation. Are you here? Can you hear me?
no, sir. There was a kid around. That's all. That's all.
Whenever you talk of COVID, there are two aspects of COVID. One is infection and is an inflammation. 90% of people are in the infective stages. You understand? So inflammatory stages are very less. Inflammatory stages require ventilators and everything, and usually their morbidities and mortalities are different. So what I'm trying to say, it's not the question of COVID patients or non-COVID patients. Whosoever you are attending, whether he's COVID positive or negative, I'm sure you're working in an institution where the comorbidity is high. You have to follow the protocols for everybody. Forget about the COVID. I'm saying COVID is everywhere. COVID is ubiquitous. It is something like bacteria. So don't think that I'm seeing a COVID patient. You presume you are seeing only COVID patient. That should be your mindset.
True.
So you have to develop each and every modality which keeps you fit, number one, and you have to develop each and modality which helps the patient also to take care of it. And here the physical therapy the most important, because lung is the hub of the problem. So all these techniques are very important, because ultimately the most important part of the lung is the breathing out, is the most important things. So unless and until you make the people do breathe out technique, you cannot really enhance their muscle strength. So IMTs are equally important and PEEP are equally important. You cannot say, I will use IMT and not the PEEP devices. If your people are not using it, they should learn to use it. We all are equipped. We do regular programs. We are equipped with all these techniques. And you have to tell your patients to buy it. As simple as that, if they want a good life. So this you have to develop, not the question whether people can afford or not. We are talking about the rules and the guidelines. You have to carry it.
It's about priority
you have
now.
to see to it the patient is using it. Yes.
It's really about priority now, and affordability is next to question, because they are cheaper than the ventilators. Obviously, they're cheaper than
Never,
the cost
Ruchika, I'm
of
telling you,
one-day
since you're
ventilator.
working in a government sector, you're talking about, there is nothing called affordability. It is a necessity. We are not
Very
talking
true.
about
Now
it.
the point is changed.
You have to create the mindset. If you are eating 3 meals a day, this is also you. It is something, if I'm wearing a spectacle, it is a necessity. There is nothing called
very true. The lockdown has decreased most of our immunity, and the only way we can build it up is through all this. I'm really glad you put all these points in one place. I am so thankful.
You have to be superhuman mindset and physically. At least you have to try your best. And charity begins at home. Okay, Ruchika.
Thank you very much, sir.
Anybody else? Any question?
Sir, 1 minute, sir. I have few questions. Like I've been seeing people asking questions. I'll just read out the question, sir. I want to know why patient pH is measured before giving them respiratory therapy.
Can you repeat, Bhuvna, once again?
I want to know why patient's pH is measured before giving them respiratory therapy. From Muskan Sharma.
pH?
Yeah.
It's other way around. Look, the most important thing in a human being is the chemistry and what we call the pH. pH decide your respiration versus metabolic. Through an ABG, what they are talking about, pH can be measured through a blood gas analysis, or a blood gas analysis can define a respiratory failure, whether you are a type 2 failure or a type 1 failure, whether you are a metabolic failure or a non-metabolic failure. So pH, by looking at a pH, you can identify and the patients you are going to handle. For a type 2 failure, For a pH, when there is an acute respiratory acidosis, the pH go down. There the protocols are entirely different. When you have a compensated pH, what you call chronic type 2, the protocols are entirely different. So based on pH, we type the type of respiratory failures when you talk about respiratory. So that helps you to decide the type of therapy.
Yeah.
Next question.
Yeah, 1 minute, sir. So next question is from Neha Joshi. 1 minute, sir.
Bhuvna, how many people are connected to this webinar today?
Almost 50, sir. 50 members.
50 is great. I think people are still motivated. 50 is a big number. I'm very proud of you guys. You're
So
still motivated and up.
from Neha Joshi, sir, along with respiratory system, any other organ is affected by COVID-19?
Yes, COVID is a multi-system disease. You know, the mortality which has happened in the West, it is not because of respiratory failure. Many of the mortalities or majority of the mortalities have happened because of cardiac factors. Myocarditis is one of the important complications of COVID. Renal failure is an important complication of COVID. Septicemia is an important complication of COVID. So not only many people, say people don't go up to the respiratory failure. Within 7 days they die because of multi-organ failure. And myocarditis, many of the people who call the heart attacks, you never know they were COVID myocarditis. So heart and the kidneys are very important organs get affected by COVID.
Yeah.
Even septic shock. Yeah.
Yeah. So the next question, sir, from Shirel. Traveling daily home from the hospital back home after treating non-COVID patients in a setup where there are COVID patients too. Is it safe to travel?
Why? Can you repeat the
question?
question?
Can you repeat the question? I think it's we are also getting, it's from Neha Joshi. No.
Yeah, no, sir. Shirel. If Shirel is there, and you can unmute and talk if you want.
Cheryl.
Yeah. You can ask the question. You can ask the question.
Can you hear me, Shiral? What's your question, Shiral?
Yes, sir. So practically what happens is before the COVID, of course, we were traveling back home from the hospital. We didn't have a setup, stay there or accommodation there. But what's currently happening is when the hospital is like 3 hours from your house, the locals are stopped, the travel is an issue, but still there's a time you need to work and go ahead as a doctor. So how is it feasible to travel back home in a setup where there are COVID, non-COVID both, and you don't have an option, but you have to treat, of course. And accommodation is a major problem. So
And your accommodation is within the hospital?
no, it's not.
How far is from the hospital?
It takes 1 hour by train and it might be 3 hours by the bus. But
So that means you don't have a mixing with the hospital crowd for sure. So you have to follow the same protocol which is applicable to anybody. Follow the hand washing protocols, follow the immune protocols, follow the mask protocol, the same protocols. You don't have to do anything extra.
Is it safe to come back home after, because it's an hospital setup, right?
No. Look, it's absolutely safe. Absolutely safe. Look, COVID is a very weak virus. Let me tell you, it's not a very strong virus. Even if you read about H1N1, it killed more people in India than this COVID. COVID is a weak virus. Don't worry. If you follow, once you get before entering your interaction with the house, have a good soap water hand washing, following all the 6 steps up to the wrist. And if you think you have really handled a lot of patients, take a bath. So normally what I do, I enter my house, wash my hands and take a bath. And I think a very simple and effective bath, which I always tell people, carbolic soap bath. It comes in the name of Lifebuoy. So I think we are all grown up with that soap. A simple carbolic soap bath and hand washing. Then you get into and do a little gargle. So normally the protocol which I follow is, I can tell my protocol. I enter the house, do soap water hand washing, take a bath, do a gargle in my washroom. Then also I take a lot of steam inhalation because I feel steam is one thing. If the virus is even if at the level of nasal passage, it will kill it because it's a heat sensitive virus. So I do a lot of steaming inhalation, upper and rear cleansing techniques. Then I mix up with the family. So these things you can do it.
Okay, sir. So it also applies if you're treating COVID in the rehab setup, or yeah, it's the same, right?
Look, I tell you one thing. In my mind, I tell you, I there is nothing called COVID or non-COVID. I presume everybody's COVID. That is my mindset. And I see my patient with the same zeal, whether he's a COVID. I presume everybody's COVID unless proved otherwise. Only thing, if there's a fever, I screen them. Otherwise, I follow the same protocols for everybody because I presume they may be asymptomatic carrier, if not symptomatic. So follow the same protocol for everybody. And that's why we talk of protocols. If you follow ABCD, you will always follow ABCD. So I always follow ABCD, whether even in Sunday when I'm not seeing patients, I do the same thing. I take bath, I wash hands, because it is so much into my mind. It is something like doing a little chanting in the morning. And even I do chanting. So protocol has to be set in your mind and make it a habit.
Okay, sir. Thank you so much.
Yeah.
So moving on to the next question from Pratibha. What is the role of physiotherapists in treating COVID-19 patients in acute setups?
I think, Pratibha, this is a very pertinent question because you are the hero or the leader in the situation, because everybody is looking up to you. And I'm telling you, you see in another couple of months, you will be the most important people in the demand in the ICU. Whosoever will educate and raise their ward to handle this acute set of people, they will be, in fact, we are looking after people whom we can employ as a clinical leaders. Our new hospital is looking for new people. So the role is that you have to be rock solid. You should have a very good immune system. You should have a very good mental system. You should be highly educated. You should be highly protected. And with a lot of attitude and protocol, which I've discussed, you have to handle them. It is something like you're on the war field. You cannot show your back. You have to walk. You have to fight from the front. And that should be the attitude. And I'm telling you, if your attitude is good, if your protection is good, COVID cannot hit you. This for sure. You have to learn to live with the COVID. And all those protocols which I discussed, follow all those protocols, all those equipment rules, hoods, everything, you have to follow it like a soldier. But you can work it. And you can, only thing is that, see to it. Whenever you are in an acute setup, which are the patients you are working, try to segregate in your mind the highly deconditioned versus not so deconditioned. Don't try to go to everybody with a similar protocol. Use your tab to make a contactless system. Don't bring your own stethoscope. Use a hospital stethoscope. Try to cleanse it. Everything. Use your little clinical wisdom that what I should be doing for him. But very sick patients, you have to follow all these protocols. So if you're already involved with very sick patients, see to it that you should not be going to not so severe patient. But since you're talking about acute ICU, that means I presume all are equally sick. I think the most important thing is your personal protection equipment, your understanding of the disease, and your immune system and attitude will play an important role, because you're the people. You have to be there like a soldier. It is something like a team leader. You have to work not only for yourself, for the patient, and also for the whole team around you, the nurses and everybody is working. So you have to create that enthusiasm within yourself and also in the whole system. And I think the right attitude will make a lot of difference.
Thank you, sir. And moving on to the next question from Ajay Singh. Sir, what will be the effect of COVID-19 on PFT?
Yes, COVID, I told you, COVID has got two phases, infection and inflammatory. If you have a simple infection, you will not have no changes in the lung, because 80% COVID is mild to moderate, is a self-limiting. But certain COVID can have an ERDS kind of situation, what you call interstitial lung disease kind of situation. Even if they recover, they can have a restrictive lung. So you can have a restrictive lung like FV1, if FVC ratio can be normal or high. So the picture may be more of a restrictive lung. And if somebody chronic respiratory disease like COPD and all has developed COVID, so you can have a mixed picture. You can have an obstructive and respiratory both. So depending upon the clinical and comorbid situation, you can interpret But usually post-COVID, inflammatory COVID, those who have recovered from ICUs, I think we expect more of a restrictive pattern, and that's why they need a very aggressive rehabilitation after discharge.
Yeah. Any more questions from anybody? You can unmute yourself and ask, or if you want, you can ask in the chat. Okay, from Pratibha again. What's the prevalence of a COVID recovered patient to get COVID again?
What is the question? Can you repeat again?
What is the prevalence of a COVID recovered patient to get COVID again?
Look, possibility cannot be ruled out, but what happens once you develop a COVID, you develop enough of innate immunity, you develop circulating antibody. That's why you see this lot of plasma therapy has been developed. So once you get a COVID, the possibility of getting a COVID next time, next 6 months to 1 year is very less, because you develop enough of circulating antibodies to take care of the COVID. So practically negligible. Unless and until you have a very serious patient, immune compromise, lot of comorbidity. Otherwise, a simply moderately healthy patient should not get a COVID again once recovered.
I think we are done with the questions, sir. One more, okay. Okay, one more question from Pratibha. And lastly, is there any X-ray or CT findings for the same?
Yeah, in fact, I can share one of the patient which I've recently treated. It's very catastrophic. I'll share in the screen this. They can have anything. They can have a restrictive lung. They have abscesses in the lung. They can have pleural effusion. They are alveolar shadows. I'll recently show one of the patient whom I treated, and I'll put this video on. And you see, these are the images you get. Just go through this. This is a typical picture of a COVID CT which I've recently treated. The patient ultimately turned out to be secondary tuberculosis also. He was on ventilator. We took him out of ventilator. Now he's on supplemental oxygen. And this is the video. Go through this. This is a typical picture of a COVID which I've recently treated. He's 49-year-old diabetic. We are just sharing this on the screen. Please hold the line. We are sharing it. Actually, phone was not connected.
Sir, we have few more questions lined up.
Yeah. Let me show this. Just see. Can you see this video? Gumna, how many questions we are left with?
We have 4 more questions.
Okay, I'll quickly. Just see, this is very interesting, eye opener. Just see this. What we are trying to show here. This is a COVID.
So nothing is visible.
No,
Your face only.
Yeah, we couldn't see the screens, sir.
Now, can you see this screen?
No, sir. No, we were.
No, sir. It's your face that is visible.
Now, can you see?
Yeah. Now okay.
Huh? Can you see? This is a typical video we are showing. Can you all see?
Yes, yeah, sir.
Yes, sir.
Just slowly you see. This is the CT we are showing. Now, what you see, there are extensive shadows in the lungs which are coming. Eccentric alveolar shadows bilaterally. Then, now you will come to know these are the CT images. The black is the lung shadow. white is the soft tissue and other thing. Can you see extensive destruction, air cavities in the lungs? See, these are air pockets, pneumothorax. These are extensive infiltration lungs. If COVID hits your lung, that means these are effusions, bilateral effusions. Can you all appreciate? These are hydropneumothoraxes, pockets. These are all fibrotic changes, extensive infiltrative cystic changes bilaterally with bilateral pleural effusion. But like it makes your lung like a hell if it goes in the inflammatory stage. That's why you require very high level of PEEP when this patient on ventilator. Sometimes you require PEEP up to 15, 18, 20 because of the stiff lungs. You see, these are extensive infiltration with bilateral effusion and cystic changes. And these are one of the rare things which people can have, because fortunately I make a video of it, so it's with me. Otherwise, this kind of pictures very few people have got. It's a, you see, these are all infiltrative changes in the lung in a COVID patient. So practically in COVID, you can have destruction, you can have cavitation, you can have pleural disease, you can have interstitial disease, you can have pneumonias. Next question.
Yes, from Vaibhav. According to you, when India will get the curve flattened, we will have to go through herd immunity. That's
Look,
what.
India will never have flattening. India always will have rise. But rise is a sign that we have developed a good immunity. Because what happens in India will have less mortality. Our mortality is the list. Everybody is going to study India because we are very strong as a human being, because our immunity is very high. The reason being, we are exposed to sun. Our 100 crore people are poor. Everybody gets exposed to recurrent flu and cold. Our BCG is protective. Our antivirals are protective. The way we eat with fingers, that is also protective. Our spirituality is protective. Our food is protective. So India is protected from flu as a mortality, COVID as a mortality. So what I'm saying, there will be no flattening. There will be rising cases, but we will not have mortality. So we don't expect flattening. Actually, flattening is applicable to the Western world. Let me explain you what is flattening. Flattening was defined by a term, means to help the healthcare infrastructure people to plan the healthcare system. That means when the cases go up, you have to procure so many ICUs and ventilators and doctors. So that is how the world has calculated. So flattening means less healthcare support you require. But this flattening is not applicable to India. India, we have a different kind of rise, what we call mild to moderate rise. They may not kill people, so but they may not consume. Let me tell you one statistics. Despite with a rise, every day the numbers are rising. Our occupation or occupancy of ventilator is 0.33%. Our ICU occupancy is 1.27%. Our oxygen requirement is 2 to 3%. Our mortality is still around 3%. So that means India will be a country with a lot of COVID like flu, but there will not be mortality. This is my gut feeling. But again, the time will tell, but hope so, it will not happen. I wish so.
Again from Ajay Singh. Sir, is percussion applicable for a COVID-19 patient?
Yes, for COVID-19 patient who is mild to moderate, and you should always see to it, because ultimately if he has developed an you're talking about percussion applicable for a COVID-19 patient. Yes, if you're handling a COVID-19 patient, depends upon what kind of severity. If is safe, you can do it. And but only thing you're taking care, you're doing a percussion with hand gloves and everything. Rather, percussion is only way which can take out your secretion from the lower lobes and your affected lobes. So secretion cleansing is a very important part of a therapist. Otherwise, your role is not adequate as a clinical reader. So every patient of COVID-19 should be subjected to regular chest physiotherapy and percussion. Otherwise, how will you do chest physiotherapy and postural drainage? Percussion means postural drainage. You have to give them postural drainage. That is the only way to clean the lungs.
Good evening, sir. I'm Divya this side. Can you hear me?
Yeah, Divya. Divya,
Let me take this opportunity to thank you for such a lovely presentation. We got to know about so many important insights. As a last question, sir, can I ask you what is your take on HCQ prophylaxis in general? Because we are starting now to go to the hospital. So should everybody be taking HCQ or what's your take on it?
my take is a little different. So far, I have not taken HCQs. The reason being, I feel that I had enough of HCQs in my life, in my formative years. I think all of you must have consumed enough of anti-malarials. Why unnecessarily upset your stomach? Also, it causes QT prolongation. Why unnecessarily spoil a drug? Keep it for good things. I use a lot of HCQs for my interstitial lung disease, but I think it is not required. Here, it's not prevention, it is protection. You have to understand. You have to move from prevention to protection. No drug can prevent getting a COVID. COVID is there with you. You have to learn to live with COVID. It is something like Delhi pollution. You have to learn to live with it.
And sir, since we'll be changing sheets and more of disposable stuff, do you think really the cost of treatment, because overwhelming majority of physiotherapists are in a clinical setup. So do you really think that the cost of treatment is going to go up?
Yes, physiotherapy will be a sought after specialty and also a little more expensive because your cost of taking care of a clinic will be more expensive, disinfection protocols and all those things. I think probably you can be a little innovative also. You can suppose instead of using frequent bed sheet changes and all, you can use synthetic materials as a rubber sheet. Rubber sheets are, and you can wash them in soap and water. This is what we are doing. We poor doctors, what we else can do? And we have at people, and those who say, yes, we want special seat, we offer them, we charge extra. So you have to keep both the things in mind.
Okay. Thank you so much, sir.
Thank you, Divya.
Yeah, thank you, Dr. Divya. And then moving on to the next questions, I think we have got a similar question from Ruchika. Role of HCQS based in different philosophy of coagulopathy, still controversial, do clarify.
Role of HC based on different philosophy of coagulation, still controversial, do clarify.
Yeah.
Look, hydroxychloroquine, I know India, one of the companies, in fact, I've been working these days. In fact, they hired me yesterday for some programs and they made a good fortune by exporting hydrochlorines from India. But, I'm sure the whole of the Western population are consuming hydrochlorines, but has it saved them? No, I don't think so. So I don't think I have a different opinion. I think unnecessarily it is something like you cannot treat an infection by giving a preventive antibiotic. You can treat the infection. You can prevent an infection, but how can you use a drug to prevent an infection catching you? It doesn't work because it is something like any other antibiotic or any antiviral. There is nothing called preventive about it. So my take is that why you use a drug which has no role still, maybe it is effective, may not be effective, but as far as COVID is concerned, how far it is going to protect, we don't know. But one thing for sure, we attain that at least we Indians, we don't need anti-malarials because we have enough of anti-malarials in our system. And everything, and our anti-malarial immunity is also there, and even it is something like BCG for us. So I don't think HCQ is a very important role in India.
So thank you. I got HCQS from him, sir, but I did not gulp it. So thanks for that.
And many times, it can give photosensitivity. It can give you a lot of problems. In fact,
that is why I was scared of them. Actually, we are already started working. We already got it from AIMS, but I did not. I know anti-malarials give a bad
I've been
effects.
associated with a lot of COVID centers. I think people who are working in COVID centers, they are also not. I think probably we should not unnecessarily get carried away and get panicked.
I got jaundice, I remember, in childhood when I took HCQS. So I did not take it that way. So thank you. Thank you for the correct
This might take
the mark response.
It's your call. I'm not forcing you not to take, but my take is
No,
that
I will do other things.
not taking.
Thank you.
Thank you.
Yeah,
Take care.
thank you.
Okay, sir.
Next, from Pratibha, how effective in suctioning and postural drainage in such cases?
I think the most important component of respiratory therapy is the positioning and suctioning and postural drainage. I think if the patient is not in a position to cough out, you have to do a very effective suctioning, sterile suctioning using Y connections. See to it that there is no much of mucosal injury. Don't use unilateral suction. I think Y connections are very important so that there is a vacuuming effect on the surface of the mucosa, because you should not damage those surface of the respiratory system. Suctioning is a very important component. I think you should do good chest physiotherapy, and I think every therapist, every doctor, every nurse practitioner mandatory do should a lot of chest cushioning, and that is a guidelines we follow to every people. And as you also is in your system, so that positioning and drainage is a very important component of any kind of respiratory hygiene, and that should be practiced and followed by suctioning in a difficult patient, because those who are not able to take out. But follow the right rules of suctioning is a must. It's a properly structured physical therapy, and this is the one should follow the right guidelines. One day we can take up a session on the on postural therapy and suctioning. A lot of guidelines are there. One should follow it.
Yeah. Thank you, Pratibha. And then again from Neha, in such patients, which body positioning is best in ICU setup?
I think if the patient is on ventilator, the best position is a prone position. Make them ulta. That is the best position for prone ventilation, and the prone positioning is the best position. But otherwise, if they are not in prone positions, if you are doing, but see to it that most of the patients, because most of the beds are Trendelberg beds, and everybody those follow the standard rules of upper lobe, because upper lobe does not require much of cleansing. It is the lower lobes have a problem and the middle lobes have a problem. I think lower lobes and the middle lobe, the reverse Trendelberg positions are very important, because I think our challenges are at the lower and the middle lobes, because upper lobes have a normal natural.
We can use pillows in to
Pillows.
place
Pillows are very important way of using. I think middle lobes and the lower lobes you should be very careful, and especially the right bronchial area, which has a direct connectivity to your your middle and lower lobes. So you should be taking care of this. And of course, I think the lower lobe on the left lung and the middle and the right lobe, these are the postures should be followed.
Thank you, sir, and thank you, Neha. Then one last question from again. Wait 1 minute. Sir. Anjali, I think. Yeah, Anjali Jain. Is supplements like vitamin C and multivitamin tablets needed, or is having good food is okay? Hello.
Yeah.
Hello, sir.
Anjali Jain asked about vitamin C. I think it's very important. As I told you, I believe in a lot of nutrition in the first half of the body, which I mentioned in my presentation. Vitamin C has a lot of good role in you, because it comes under a fat soluble vitamin, water soluble vitamin. Vitamin C has been found to be as a protective agent. A lot of antiviral role has been found in vitamin C, and otherwise also. By taking vitamin C, you get a lot of antioxidant effect in the body. Ultimately, whatever the viruses or bacteria you're getting, they cause oxidation. So you need to have a lot of antioxidants. So vitamin C plays a very important role as an antioxidant. But what I say that I don't believe in supplements. Go for natural vitamin C. Go for natural vitamins. So having fresh fruits and veggies are the best way of consuming vitamin C and multivitamins. So I'm not a proponent of using vitamin. I don't know which are the vitamins available, nor I want to know. I think through your food, you try to enrich yourself with a lot of vitamin C and multivitamin. They act as an antioxidant, and the concept of smoothie, which I discussed, is a very useful way of starting the day as a detox.
Thank you, sir. And then from Ajay Singh again, which mode of NCV should be preferred? BIPAP or CPAPA? Or
Look, Ajay, non-invasive NCV is NIV. I think non-invasive ventilation, always you should follow the bilevel, because non-invasive ventilation, when you handle a respiratory, it is what happens. You need a E level, you need a E level. So problems are respiratory failure. C level is a splint device. CPAP is only used in cardiogenic pulmonary edema and sleep apnea. You're not handling sleep apnea, cardiogenic pulmonary edema. You're handling a respiratory failure. So you need a non-invasive ventilator. So bilevel is a ventilator. So where you need the right EPAP and IPAP. So obviously you need a bilevel with a good humidifier.
Yeah, sir. I think we are done with the questions so far asked.
How many questions have been answered?
I think close to 10 questions or 50.
Really good.
Yeah.
50 people and 10 questions, fairly a good go.
Yeah.
Any comments from anybody? Hope you people enjoyed it, or any inputs, let us know. Go to our website. And all of you, you can note down my mobile number, 9810159687. You can text me.
Sir, you have to repeat the number.
Yeah, I'm giving in the text.
Put it in the chat.
Don't worry, I'm putting in the chat. Don't worry, yeah. Yes, sir.
98101. This is our universal hotline number. We can stay connected with an audio or a text. This is my number. Will not change till I die.
98101
59687. All of you keep this number handy. Any inputs, any ideas, share me. I'll incorporate it.
98101
59687.
Yeah.
Dr. Bose. You can save it as Dr. Bose 98101 59687. We have also typed it for everyone, 98101 59687. And also we are typing our email. You can write to us. You can go to our websites, Trans Foundation and CICM website. Both are.
Sir, you are on mute. Yeah.
Thank you, dear friends. Thank you, every soldier with this arm suit. I salute you people. My best wishes for all of you. But my take-home message is that feel good, stay healthy, follow these tips, and fight it out. You have to be a soldier, but stay safe, but stay healthy. Thank you. Have a great day.
Thank you, everybody.
Same to you, sir. God wishes to you too. Thank you.
Thank you so much. God bless you.